this video, we will review Home Health System Overview. We will review the tabs at the top and navigational tools, along with high-level functionality of our system. Based on your permissions and roles, you may or may not see all of the options we review today. First, we'll go to axxess.com, and to the top right-hand side, we'll select Login. You'll enter your username and password provided to you by the agency. If you forget your password, you'll click Forget Password. Enter your address, your email address here. It'll get a new activation link in your email. That link will be good for 48 hours. Once you get your password set, you'll come back to your login screen, enter your username and password, and select Secure Login. You'll get a disclaimer saying that this is for business use only, and select OK. The first page that populates is your Axxess Planner. If you're a clinician, you'll have a clinician planner. We'll go into this in more detail in the clinician's training. To the left, you'll have all the different subscriptions you apply to you, different agencies you might work for, or different products within Axxess. You'll select the Axxess Home Health with your name on it. The first page that populates once you're in your agency is your dashboard. Now this is role-based, so everyone will have at least the top 5 tiles here, but depending on what you have, it might change. This first tile to the top left-hand side will be a video. This changes periodically depending on what's going on in the industry, maybe just between home health or hospice. Right now it's our wound manager. It's a newer feature for us. You'll have a date and time tile. You'll have a messaging center. You'll have a news and updates, so it contains blogs, and a My Scheduled task. Okay. The others will be a role-based. So under messages, you can compose a new message. You can enter your inbox here. You can select an email and it would open up that one email. You can multi-select and choose to delete certain ones. Notice that you only see the top 5 of any category on this page. If you want to go into more detail, you can select more. From here, you can compose a new email. This is HIPAA compliant, so it's only going to be able to be done within people within your agency, so other employees that you have there. You can search for certain employees. Okay. You can choose a subject. You can choose a patient. This is a reference point only. It does not hyperlink or go into the patient's chart in any kind of way. You can request a read receipt. You can attach a file. And then you have normal email formatting functionalities here. You can toggle between your inbox, your sent box, and deleted box. You can select all or multi-select particular emails to delete. If a message comes from Axxess, you have the option to delete or print it, but you cannot reply. Within your agency, you're able to reply to all, or forward. Under the news and updates, if you select one of the blogs or if you hit more, it'll take you into those blogs. Those are recorded almost every day. Within these blogs, you will sometimes have other hyperlinks to other platforms or other websites, things like that. You can choose from different topics to review other blogs. The next one is My Scheduled task. Everyone has this tab, whether you see patients or not. If you see a patient's name with a hyperlink anywhere within our system, if you click on that patient's name, it'll take you straight to their patient chart. This column here is a column is for authorization. So if this patient required authorization, it would either have a check mark or a warning sign saying it does not have authorization. If it does not require authorization, it'll be blank like this one. Anywhere in our system that you have a task that has a hyperlink, you can click on that task and start your documentation straight from here. And then you have a date. Again, you only see the top 5. To see more, you'll click the word more. You can group these by patient, by date, or by task. You'll only be able to see 3 months into the past and 2 weeks into the future. We'll go over other ways to access older visits if needed. You'll have a patient name, an authorization column, that task column still that you can go in here and work on this. It's kind of like your to-do list. These are all the things that you have not quite finished. You've got a date. You have a status. You have alert columns here. So anything, if your patient had an alert on it, you'd see those here by hovering over them. And you have a missed visit form. You need to know too that if you need to do a missed visit, it has to be assigned to that person. This is unique to the person that is logged in, so only that person can do a missed visit. You can click on that missed visit form here. From here, you can choose if the order was generated or not, or if physician office was notified, what the reason for the missed visit was, document anything that your agency requires, and a staff signature and date. Click Submit for it to go into your QA. The top right-hand side, if you want to get back to your Axxess Planner, you have a link to your Axxess Planner. You can refresh or export this list. Now, everybody has this tile because if you need to document anything for payroll that is not directly linked to a particular patient or task, from here you can hit Add Non-Visit Activity. Choose the date of that non-visit activity, what the task is. If you'd like to choose from multiple locations, your time in and time out. If any associated mileage is there, you can add that, a destination, and any additional comments. Select Save for all of this to go over to your payroll. The next tab is patient birthdays. Case managers, admins, and DONs will have this tile. Gives you a list of all your patients and they have birthdays for a particular month. Gives you their address and phone number, so if you'd like to be able to send birthday cards or something to that nature. You have a past due research report and an upcoming research report. These also are role-based that will be for case managers, DON, and administrator. So let's look at this upcoming research. If I click in here and say More, you'll get a report. You can filter by particular branches if you'd like, or insurances, or by selecting a patient name or medical record number. You'll notice a patient name, medical record number, who the employee responsible is. So who's this recertification scheduled to, because this is for upcoming research, what the status is, and the due date. The important thing to remember on this report is the due date is the last day of the scheduled episode. So today is September 11th. So this is due September 12th. I would know that I have 1 day to see this patient for a research, or I would have to discharge this patient. The past due research is very similar. Same information, but you will also have how many days past it is. And the outstanding claims tab is only given to people with administrative roles or billing roles. Now let's go through the tabs across the top. Under Home and My Account, if you go to Edit Profile, when you first log in, your password and your signature are exactly the same. Your password gets you into the software, where your signature signs off on documentation and gets you into the company setup. To redo your password, you put your current password, put a new password, and confirm your new password. For your signature, you would do the same if you know it. Once you change one of them, they're independent of each other. You can make them match and you can keep your same passwords for as long as you would like. But if you change one, you would have to come in and change the other. You can update an address, a phone number, and you can choose for a software language as well. These are navigational only, so the documentation inside of the notes would still be in English, but if you wanted the tabs at the top to be in Spanish and everything included inside those tabs to be in Spanish, you could do that. You can verify your Social Security number. If you do not know your current signature would like to reset it, the next option under Home and My Account is Reset Signature. Here it'll say click the button below and it'll send you an email. Same thing as your password. You'll send you an email with a link on there. It's good for 48 hours. The next one is My Dashboard. That's the page in the background that you already currently see. My Messages we've reviewed, and My Scheduled Task we reviewed. My Monthly Calendar, again, is unique to whoever is logged in. This is kind of like a total productivity, everything you have done. So all patients that you have seen and all tasks that you have seen will appear on here. You can go as far as you want into the future and as far back as you want in the past. So if you'd like to go back more than those 3 months that we're seeing on the My Scheduled Task, you can do so here. You can see up to a year. If you click on this one, you can see or hover over it, you can see this is scheduled and it tells you the one visit that I have for the one patient I have. Looking at the key here, you can see the green are completed. And the purple is multiple. So if I hover above this, I may have multiple patients and multiple tasks. If I want to see these expanded so that I'm not having to hover over to see everything, I can hit print. It'll create a PDF with everything already opened up. Everything will appear in here, communication notes, physician orders, everything that you complete here. The bottom, you have the same scheduled visits will be down here in a list format. You have a patient name. You have a column here for authorization, one for task. Same thing, it's hyperlinked. So if you wanted to start this visit, I can click on the visit itself and start documenting. Got your status, any alerts for your patients will be in these 3 columns here, and your missed visit forms. If you were going to have another clinician sign off on another clinician's note, you would have My Pending Co-Signature Notes. This is permission-based, so depending on the roles that you serve for your agency. You could see any visits that were turned in that need to be co-signed. You could select that visit. You can review the visit. Choose co-sign and co-sign your signature here. If you select co-sign, it'll go into QA. If you select co-sign and approve, it will bypass QA. So this is just stamping your name. You also have the option from here as you're reviewing to directly return the note, put a comment here and return it back to the original clinician. Under the Home tab, the next one is your Quality Assurance Center. We'll go over that on another training. And an EVV Exception Center. This report will go through if you're sending anything in batches to another vendor like SanData or TELUS maybe. If the submission didn't go through, it'll list it here for you. Under Create and New, the referral, patient, and episode will go over on intake training. Composed message we saw already in the Message Center. Communication notes, orders will go over in clinicians training. You can add those on for multiple patients here. Your physician face-to-face encounter will go over on intake. And then here we can add new things to our agency. So under create, new, and facility, you'd come in here and type in maybe a hospital name and select that hospital type. So you may be the Shore Acute Hospital. So this isn't going to be for doctor's offices, but things like your nursing facilities and your rehabs. This is going to go on your intake for referral, so you can run referral reports. You'll fill in the facility name, type, address. If you know a contact there, that's great information. You do have a comment section also, so if you need to put that you're only allowed to go on Wednesdays or something to that nature, you could add a comment here. Under Create and New, Pharmacy, you can add a pharmacy name, an address, and phone number. It's very important that you put the phone number. The clinicians will have some one-touch calling on our mobile app, but they'll need that phone number. If you have a contact, first name, last name, you can add that, or a fax number, and any comments. Under Create and New, Insurance and Payer. We'll go over this in an additional training. But if you want to go through it, this is where you would add any of your new payers. Anything here that has a question mark, you can hover above, and it'll tell you exactly what it's looking for. You will need to enter your own payers, as every state and every contract is different for each agency. You'll choose if they're episodic or per visit, and fill in any information required by those payers. Under Create and New, Physician, you can come in here and search by the MPI number. Select the physician you're looking for. It'll give an address that the physician used for their MPI registry. You can come through and edit if they had like more than one location. You could come in and edit that. It will check to see if the patient or the physician is PACOS verified. You can choose an order delivery method of either Axxess Physician Portal, which is our electronic signature, fax, or mail. Under Create and New, you have Contact. This is kind of like your online Rolodex. You can put any contacts you want in here. So I see a lot of labs or transportation agencies. You can put their name here, whoever the contact information is here, and any comments. Under Create and New, you also have incident and infection logs. We'll go over those during the clinician training. Under Create an OASIS export, all of your OASIS that have been approved and are ready to be sent to iKeys will come here for you to be able to generate that file and download and send it. We'll go over that on another training as well. Under View, you have List. Most of the categories on here are going to give you a list of things you've already added. So a list of any patients that you have in your system, referrals, contacts, templates. When you get to templates, Axxess has already added quite a few templates for you. You can go into any of them and select this button here to edit and be able to make any changes as you would like. Templates are used throughout our system. You'll have little spots that'll say templates. You'll choose this title and this verbiage will fill in. You also have the option to delete any templates that have been added or to create your own new template. When creating your own new template, you can go in here and add an asterisk. Anytime you put an asterisk, the clinician adding the template will be forced to edit that right where the asterisk is and be able to take the asterisk out to be able to move on and complete their note. So if there's something you want them to edit and pay attention, make it patient specific, just add the asterisk in there. Under View and List, the next one is Supplies. We'll add a description. We'll add a HCPCS code, but the revenue code and unit cost is up to the agency to add. You'll need to come into each one of them and select Edit. You're able to go through and change the description to make it something that your clinicians would be looking for. Your HCPCS code is already listed. You can come in here and add your revenue code, whatever it might be, and then you'll add your unit cost with your markup if needed. And you'll hit Save. It's very important that you go in and edit these supplies because they will transfer over to your claims. Under View, you also have the option to view blank forms. So if you needed to go through and print any forms off for emergency purposes to be able to document on paper, you have those here. Archived insurances are any insurances that you no longer use. Exported OASIS are any OASIS that have already been sent to iKeys. Not exported OASIS will be any OASIS that you complete for a payer that does not require submission to iKeys. So if you had a commercial payer that you did an OASIS on, you would be marking them as completed, not exported, and they would come on this list. We've already seen the past due recert report on our dashboard, as well as the upcoming recert on the dashboard. Orders management is our orders tracking. You'll be able to see any signatures that need to be added to co-sign on additional orders for clinicians. You'll be able to see any orders that need to be sent to the doctor, any that have been sent to the doctor but now are pending signature, and orders history for all orders. The print queue will just give a list of items that have not been marked off as printed. So if you wanted to go through and print something, you can say, I want to print all of the orders. You select which ones you want to print and print them off individually, then mark them as printed. Under patients, you have a patient chart. You have a list of any existing referrals, a list of any pending admissions. So patients will go from referrals to admissions. You have a list of non-admissions, any patients that have been deleted, any patients that have gone into the hospital, and if your state requires it, you'll have your pre-claim review center here. Under schedule, you have my schedule task we saw already with the dashboard. My pending signature of notes we saw earlier as well. This is where you're able to select this and co-sign on that signature on that note. You have a schedule center. This is where you'll schedule your patients. You can reassign any visits from one clinician to another here. This is a report to show you any visits that have not been scheduled. Your schedule report will give you a total of all visits here. You can choose between a particular agency branch or patient, a clinician, a date range. You'll choose a status, whether you want to choose a missed visit or not yet started or saved or all. Here, this box is telling you need to have one or the other. So you can choose a task and choose one particular task, or you choose a discipline and you can choose one or all disciplines. You can generate your report. Same thing if you select on a patient and take you to the patient's chart. Anything that is not yet started or not yet saved, you can go through and reassign to another clinician, or you can multi-select and reassign all. You can also export this list into Excel. Under schedule, you also have a schedule deviation report. This will show you if a patient was scheduled on one day and the clinician documented their visit on a different day. We'll go through Axxess Care on a separate training if it pertains to your state. This is our online staffing scheduling. Billing, we'll go through on another training. If you have Axxess DDE, you will have a spot here for you can go through and switch to our Axxess DDE platform. You can enter the black screen, which is Medicare's billing. You can go into our billing center to be able to see the claims that have been created and submit your claims. Your pending claims will take any of those submitted claims and show you what is still pending to be paid. This Medicare HMO PPS, this is an old format, so anything prior to PDGM. So for agencies that have been in the system for a while, that is still there. You have your create claims and claims history here for your managed care. You can also do that in our billing center. You can see all claims, any claim submission history, and be able to see remittance advices. You have a PDGM tab under your PDGM center. Anything underneath that tab is also here. So if I hover into this PDGM, you'll see each one of these are listed across the top. Here you'll be able to see any patients you have a LUPA risk for. If you click on the number 4, it's going to drill down into which 4 patients are at risk for a LUPA. Notice this is 4 patients, but you have a first 30 days and a second 30 days. Same thing here. If you go in and click onto any one of those, it'll drill down into which patients those are. It'll give you an agency percentage. You have an average length of stay. Notice you have question marks in each one of these boxes. If you click on the question mark, it'll give you more information about that report. For instance, this one, if you have 30 days or shorter as your average length of stay, it appears in red. If you have something from 31 to 120 days, it'll appear in blue. And if your average length of stay is more than 120 days, it appears in orange. You have your upcoming 30-day review. There's 7 patients. It is in black. This noted that you cannot click on this one to drill down. Same thing here. It is in black. I can't drill down into this one. For upcoming research, you have reports for both of those items. It'll give you a percentage of outliers year to date. It'll give you an average gross margin for, and it'll say actual and expected. This is for your first 30-day payment period. You can switch those back and forth. And this is for your second 30-day period. Moving down, you have an average expected payment per payment period. So you have each of the 12 top clinical groupings. If you click onto neuro rehab, you can see that your average expected payment per payment period is $2,782.42. If I click into this one, it'll drill down and tell me which one of my patients have some kind of neuro rehab as a comorbidity, primary grouping comorbidity. Okay. You can choose between first 30 days and second 30 days. Your numbers of patients per clinical grouping, it'll do the same thing. Your clinical groupings are here, shows you how many, and you can click into it to find out which patients those are and be able to switch from first and second 30-day period. You have admission, source and timing, functional status, and comorbidity adjustment for both start of care and research here. You can hover above any one of them, give you the percentages, and if you click into them, it'll drill down to say which patients. Moving on, you have average estimated margin per billing period. Again, you can click into this to drill down further. You have first 30 days and second 30 days, and average visits per episode with the first 30 days and second 30 days. At the top, you also have your billing center. If you have privileges for your billing center. You have a revenue impact analysis. This will show you under PPS what you were making versus what you could be making under PDGM. You have a PDGM modeling tool. This is great for instructing your clinicians or to kind of get a projection on a patient you're considering taking. You can choose community early or late, institutional early or institutional late. You can come in here and start typing a diagnosis here. You'll notice that I click on this one, there is an arrow saying that I need an additional number or character. If I click on it, it's saying, what am I having contact with? And it's going to keep drilling down. Okay. This one is telling me the primary diagnosis selected is not payable under PDGM. Selected primary diagnosis included in the PDGM clinical grouping to calculate a HERG score. So it will give you a warning so you can contact the doctor and let them know this is not going to receive any payment. If you know that the code, you can also come in here and type a code in. So you can search either by diagnosis or by code. When I put this in, it's telling me this is a neuro rehab code. If you have any comorbid conditions, you can come in and start typing those as well. And it'll let you know whether or not there's an adjustment from the to diagnosis. You can add as many diagnoses as you'd like. Okay. Now you can see I have a low comorbidity adjustment. You can choose a functional impairment level that you're estimating. This comes from 5 of the functionality questions on your OASIS. So since you haven't seen the patient yet, or you don't know what those OASIS responses will be, you're taking a guess. You'll choose between low, medium, or high functional impairment for your patient. Then at the bottom, you'll get a summary that says if they're community early, here's my primary, what grouping they'll fall under, what functional impairment level they are, any comorbidities. They'll all summarize here. Then it gives you an estimated for your first 30 days and second 30 days. Gives you case mix weight, HIPS code, the LUPA threshold for each, and the potential financial outcome from this. Making any change will change the financials and the LUPA thresholds. The next one is a PDGM Center patient list. This gives you all of your current patients. You can see here they have a triangle. You'll see a key at the top is for my started care. I have a recert, my PDGM dashboard, my 30-day calendar, the patient scheduling center, and whether or not they're a high hospitalization risk. You can also get a learn more. It'll take you to your help center here. You can go into our billing center, export to Excel. You can filter for particular patients at the top. Okay. So if I click into this first one here, it's that PDGM dashboard for that one patient. So it'll tell you if they're a DNR, any alerts on that patient, what the episode ranges are. It'll tell you if they've had any infections, incidents, wounds, hospitalizations, or any vital signs out of parameters. Shows you any missed visits, any supervisory visits. If they're at risk for a LUPA, you can access their 30-day calendar here as well. Shows you any outcome potential to improve for your patient. It will tell you on your first 30 days, and if you're currently on your second, it's going to say that. Gives you your HERG scores for them, your LUPA thresholds and payments. Gives you a cost analysis and supplies entered by the clinicians for that particular episode so far, and their frequency and duration. Going back to the dashboard, the next icon here is their 30-day calendar. You can choose between your first and 30-day calendar here. First and second 30-day calendar. You have a key. You can hover above these for that clinician's phone number to easily be able to access that and call them and say, hey, I need your visits done. It's going to highlight with the blue circle the current date. And you can see when the end of episode is, or if you're in your first 30-day, you can see the care period decision is due. If you click view frequency and duration, any orders for frequency would be listed here at the top. The next icon is your 30-day or your schedule center. This is where you schedule your patient. And then moving over here a little bit to the right, you'll see your hospitalization risk. You'll see some of these patients here. It's just telling you you're at risk for hospitalization. The next tab is your admin tab. You'll notice under new, majority of these are the same as what we already went over on create and new. All of these here are the same. with the exception of a non-visit activity we'll go through on our payroll training and a user during our user training. Same thing for list. Most of these are the same under view and list. The exception would be the non-visit activity. This would give you a list of any non-visit activities you've created. And adjustment codes. Here you can add different adjustment codes to appear on a drop-down list in your billing center. You will already have bad debt and contractual obligation added for you. You can add a new adjustment code. And choose positive or negative and select save. You can also edit or delete those. Under admin and list and documents, here you'll also be creating a list to choose from on a drop-down menu when scanning documents. There's about 6 already there for you that Axxess has already started, but you can go in and edit any of those or delete. If you'd like to customize a new one for yourself, you could do new document type. And select save. That option will now appear on a drop-down when creating scanned attachments to your patient's chart. Under admin, deleted users will give you a list of any users that have been deleted. Payroll summary will review during our payroll training. Accelerated Payment Center will give you links to apply for an accelerated payment. Non-visit activity manager will go over during payroll. License manager, you'll be able to see any users or non-users license when they expire and be able to update them from here. You can add a non-user license. Fill out the information so that you can keep track of any users such as a doctor or somebody who may not be in here as a user. You have a custom note manager. Any one of our titles, when you're clicking a header for one of these columns, we'll put them in ascending or descending order. So I clicked on original name to sort these out. This is going to create a custom title for a task that is already in our system. So let's say if you wanted to have a communication note, instead of it saying communication note, you'd like it to say cardiac lab results so that you can schedule this to a particular user and say cardiac lab results on your calendar. You can do that here. You can edit and delete anything that is there. You can create a new custom note. Let's say a skilled nursing note. And we'll say RN morning visit. You can add a description if you'd like. Now, anytime on the calendar, if I schedule an RN morning visit to someone, it would differentiate this from a different regular skilled nursing visit. When they open the task, it will look the same as a skilled nursing visit. The last tab under admin is company setup. There's an entire training video for company setup. Under reports, you have report center. All of our reports are grouped into categories. So you have patient reports, billing, financial reports, statistical reports, and users will be able to see whatever is assigned to their permissions. In each category, the reports are in alphabetical order. If you hover above each report, you'll get a description, what the search parameters are, and what the report will include. If I select average length of stay, you have ICD-10, you have an ICD-10 lookup, and an ICD-9 to ICD-10 crosswalk. Live training webinars will take you to our Help Center to where you can watch those. You have support training. Community will take you to some of those blogs. Help Center will take you to the basic Help Center homepage. And Launch Join Me if you're having trouble with your system in talking to one of our support coaches. If they need to be able to see your screen, you may use Launch Join Me. Recent software updates will take you to that section of the Help Center. Same with the COVID-19 Resource Center. Your support ticketing center will only be available for the 2 people you choose as a super user in your company setup. From here, you can create a ticket. Please remember to be as descriptive as possible and give as many details as you can. Okay. Go through, answer the questions, add any screenshots or attachments as you can, and add a very detailed description. You'll select Submit, and one of our support representatives will get that information, address your issue, and respond back to you. If you would like to view the status on any of the tickets you've already put in, either via phone or by the Support Ticketing Center online, you can choose View Tickets. And you can come in here and choose the ticket you're wanting to inquire about. You'll see any activity made on that ticket, who was it created it, and your agency name. You can also put any comments here, like I would like an update. And then put Add, and whoever created that ticket will get an alert to update you. At the top, you also have a link here to go back to your original Axxess Planner page or log out.